issues in Bungalow. Today, we are gathered here because of the celebration of the World Mental Health Day, which was yesterday, but still is an extension. Every day is a day about mental health, especially because we are in a polycrisis. There's so much happening in the world that is stressing us out. There's a lot happening in the development and community and human rights field. There's a lot of information on social media, so we have information overload. There's an economic crisis. All of us are stressed about the economy and other issues, personal and political, that affect our well-being every day. I thank all of you for joining us today. I shared the program with you earlier. And so we are just going to go through the program, and it starts off with our keynote speaker, who's Haron Modena. So Haron, I'm going to give you 10 to 15 minutes to do the keynote speech before we go to our speakers. Welcome.
Amazing. Can you hear me? Okay. Thank you so much for this awesome engagement. And thank you so much for hosting this session. Highly appreciate it. It's one of the most interesting engagement because I've never had this kind of a conversation, the intersection of mental health with the activism sector, especially dealing with the most marginalized young people. Yeah. So for this session, I'm just going to share a little bit of experience, stories, and as a way to build this conversation way forward. If we are ready for this, can I see thumb up? Just use the thumb button, or you can just comment that via the chat section. And also, if you're interested for this conversation, please feel free to use the comment section. We will highly appreciate to read your comments. Yeah, and if you need any new clarification, please feel free to use the comment section, and I'll answer those questions after my keynote speech. So to start our today conversation on the importance of mental health in activism, good afternoon, good morning, where you are joining as a friend, colleagues, or fellow change makers, young leaders. And this day, I'm more than honored to be with you today to talk about this awesome subject, which rarely people talk about the mental health in activism. And it's something which I like to share some crucial work of what I've been doing, and also this kind how I've been dedicating my life to challenge this kind of systematic injustice and advocating for the vulnerable people and championing for those whose voice aren't heard. Because I realize those from the marginalized regions are doing amazing work, but they lack this kind of space, this kind of support to amplify those voices. So, mental health isn't just a kind of a medical term. I know kuna some psychologists here who will help to fine tune some things from my side. Just to share as a disclaimer, I'm not an expert. I'm not a mental health expert or a doctor. I'm just a normal human being sharing my very authentic story and more of a resiliency and my drive of how I build things from scratch. Yeah. So I will start with the mental health challenges activist first. And many of us in this room have likely felt too overwhelmed with the weight of the roles we hold as activists, which we mainly shoulder our responsibility working on issues that are more of raw, very painful, and very personal for each one of us. We confront difficult truths about this world, and some of which reflect challenges we have been faced ourselves. Personally, I, I've been there too, facing rejection, fighting stigmatization, persisting through marginalization from grassroots level of Kilifi County to the county level, to the coastal regional level, now at the national level, and these things that keep continuing at the global level. So these are some of the facts of being an activist. Of always, those in powers will try to repress you, but that should not stop you. It should fuel you to keep moving. So, fellow colleagues, these experiences are real, and they really accumulate. We battle issues of multiple fronts, often with limited resources, and sometimes without visible change in sight. The relentless pressure can lead to burnout, emotional, exhausted, and even sometimes feeling like giving up. Even you'll agree with me, statistics show that mental health concern among activists, it's at an alarming rate. Studies suggested that activists are more prone to symptoms of depression, anxiety, and post-traumatic stress, owing to the intensity and emotional nature of our work. Yet, these issues are hidden, undiscussed, and untreated in our cycle. And I wonder, why is it that we are trying to show how to do things in a right way, but as you're doing this, you're being repressed? I don't know what, I don't know why, but I think some of our colleague, you'll answer this. Point number two, it's about working with a vulnerable population and secondary trauma, as this was one of the goal of this session. So a significant aspect of what we do involves engaging with a very vulnerable population at a very deep grassroots level, whether it is supporting survivors of violence, those who are working within the SGBV, working with the marginalized community, those at a grassroots level, at a refugee setup, or dealing with the LGBTQ community, or advocating for those who face discrimination. We open ourselves up to remain up to the pain of others. Empathy is what drives us, but empathy without boundaries can lead to what psychologists call secondary trauma. I know there's a lady who is a psychologist who will help to correct me if I'm using the real terms. So when we observe the trauma of those we are helping, sometimes it's really impacting us negatively. For example, I can share my own experience in my journey of working with young people and advocating for gender inclusion and safeguarding aspects. I've seen and I had countless stories of struggle. This story motivate me, but they also leave imprint on us. Secondary trauma can lead to symptoms similar to those experienced by the individual we are supporting, such as anxiety, something I usually struggle with, sleepless nights due to lack of resources, and I'm feeling like I want to address this thing, but there's no resources. So what should I do? You see, and why are we not being given these resources? Despite that, we are trying to be authentic. Yeah, so sometimes it give us sleepless nights, and so lack of sleep sometimes is trigger mental health, extreme depression. And because we don't always feel entitled to this trauma, we tend to keep it to ourselves, open to recognize that we too need to heal. So we tend to be so strong and show the public that we are so strong. But we need to realize one thing as young people, that we are also human beings. We also have emotions. And after this session, I'm expecting who are part of this conversation and those who will be watching this recording to to share their own story as a way to challenge decision makers, donors, the development sector, the private sector, that are we as young human rights defenders, we also need this strategic support. Inclusion should be non-negotiable. Another point is about breaking silence and stigma. Please, the moderator, you will kind of alert me concerning time because I can talk throughout. So also, there's a part of breaking silence and stigma, and there's still a strong stigma around mental health, especially within the activism community and world. We fear that acknowledging our struggle might make us appear weak, incapable, or distracting from the cause. Yet, sorry, I'm just laughing, but I'm I'm feeling that pain. Yet, addressing our mental health challenges is not sign of weakness. Let's get this right. Addressing mental health challenges is not sign of weakness. It is an essential step to preserving our strength. When I went through a period of self-doubt and anxiety, I realized that by hiding these challenges, I was only isolating myself further. It was through opening up, seeking connection, finding support that I began to reclaim my resiliency. And those who have been following me via my LinkedIn platform have been so authentic and I've decided to be myself. Some have been judging me, and it's okay. People will judge because we all have freedom of speech, freedom of expression, but it's my own space, so I can do whatever I want to do. Colleagues, we must remember that just as our activism speaks out for being silenced by society, we too must not silence our needs. Let us practice the self-care as a community care and act respect of our work and our colleagues. Let's support each other. Let's not fight each other. That's very, very, very critical. Another point is about the importance of addressing secondary trauma. To truly sustaining our movement, we need to address secondary trauma head on. Colleagues, I repeat, head on. This means let's create a safe space within our networks to discuss mental health openly without any kind of judgment. It also involves training ourselves to recognize these signs of burnout and trauma in ourselves and others. Simple practice can make a world a better place and bring this difference. I found that digital detox, small support cycles, structured debriefing session are effective to help activists release the emotional weight we carry. For those of us here today, we might consider integrating practices within our organization. So by encouraging open discussion about the mental health and supporting one another through tough times, we can foster a culture of shared care where we check on each other regular. Please, if you observe your colleague is not active, just call, text, are you okay? And something we are doing is that we have a program known as a Changemakers Hikes and Adventure. The main goal for this also is to address the mental health issues by bringing the nature aspect. Every weekend, we take young people outside the nature to connect with nature, to meet each other and be authentic. This is one of the strategic way to address this secondary trauma. Another point I would like to share is about building support system and normalizing seeking help. It's okay not to be okay, and we must actively build and maintain support networks for ourselves and for each other. This support doesn't need to be formally or costly or transactional. It can be simple as a weekly check-in with trusted friend, colleagues, or monthly cycle where we gather to share and decompress. I've learned that surrounding ourselves with people who understand, who can listen without judgment, and who can provide perspective can be one of the tremendously healing. And please, colleagues, take this seriously. Also, professional help should also be normalized. Therapy, counseling, and even mental health workshop and invaluable tools. Activism is a marathon. I repeat, activism is a marathon, not a sprint. And just as an athletic would care of their body, we need to care of our mind also. I know seeking therapy, it's one of the most expensive thing, but also we should find alternative way of how to deal with this issue. My last point before I give closing remarks is that we need to reimagine the activism with mental health at the core. Our work is more of a revolutionizing, but being a sorry for the Latin, but being a revolutionary Kizungu needs resilience. Like doing what we are doing, there's a need of be a resilient person. This journey is not easy. Let me be the fact. I'm not that guy. I will tell you how I started a chicken business with a single egg. No, I will tell you the real part of it. Being a founder, be a co-founder, being a director, managing organization, managing people, it's not an easy thing. You need to be resilient, and sometimes things will hit you so hard. So resilience and consistency is everything. Colleagues, we cannot continue to build system of equality and justice if we are not mentally health ourselves. Change should start at individual level. Imagine if we redefine success in activism to cool our well-being. Imagine if our campaigns didn't just advocate for social change, but also created sustainable models for health of those who lead this campaign. We have a responsibility not to just to our community, but also to ourselves. Activism rooted in mental well-being is activism that will make us prosper. By investing in our mental health colleagues, we are investing in a long-term impact of our work. My closing remarks is that today, let us commit to taking care of ourselves and each other. Let's acknowledge that our emotional health matters just as much as our transformation work. As we continue to tackle this systematic injustice, let us tackle the resilience around mental health. Let us champion self-care and act collectively. Thank you for your courage, your passion, your resilience. Together, we can create not just a better world, but a healthy, strong, and more sustainable community for fellow change makers and for ourselves. Thank you so much, and back to Elsie.
Thank you so much, Haron, for that. You've packed in a lot of points in one statement, and I'm thankful for that. I'm hopeful that this conversation will come up, of course, in the time of our interaction. I made you a host, so I'm no longer a host, but I know that there's some people in the waiting room that are waiting to be admitted. It's unfortunate that they've missed this bold statement that you've made. I think one of the key takeaway from me from your conversation and what you've shared is that our activism should be rooted in mental health, and we should reimagine activism with a mental health at the core. So I know we have more to share with the course of the time, so I will also share my reflections as we continue. But now I would want us to progress to our speakers. And as we start, I would want us to share this, to go through this session, the next session in the following manner. So the speaker will introduce themselves, where they work and what they do. And then after telling us who they are, then they will share their personal stories of the mental health in their workspace. Have you ever felt overwhelmed? Have you ever felt emotionally drained by your work? How was that experience for you? What happened? And how did you deal with it? So I will give each speaker at least 5 minutes to introduce themselves and to share their mental health journey in relation to the work that they do. I don't know if we are going to start with ladies first or gentlemen first, but we can start with whoever is comfortable starting. And then after you're done, pass it over to the next person. I give you the chance, the opportunity to select the next person to speak. But I will select the first person. So welcome, Anne.
Thank you so much, GforGirls Initiative. First of all, I would like to thank Mr. Haron for giving me this opportunity to be part of this interactive webinar. It's really good. And thank you for having me also, GforGirls Initiative. So I don't know whether I'll change my name in future so that I can start with the Z so that I don't have to be the one starting. But it's okay. So my name is Anne Guduku. I'm a change maker. I'm a counseling psychologist. I'm a mental health advocate. I'm a founder. I'm a co-founder. I have a list of many things, but for those are enough for now. You've asked what I do. Yes. I support people who've gone through child loss, those who've gone through infant losses, miscarriages, those who've gone through different types of child roles. That is what I major on, but also I do counseling to the generally to all kinds of people of different ages. So have I ever experienced secondary trauma? Yes, because as a counselor you need to do what we call psychological first aid to survivors who've gone through traumatic events. So for psychological first aid, you attend to those clients before they get into post-traumatic disorder, as Harun had stated before, the PTSD. So yes, I've experienced secondary trauma, and most of the time in my work, clients narrate stories that are so overwhelming. Even at times you feel like, now I don't know how I can move on. The stories you hear, at times you'll be called to support those who are who will experience their child dying, or who have just died, and take them to the morgue. So there are so many instances and several instances that have made me to fall into secondary trauma. So for now, that is it. I think I've answered all your questions. The 3 questions.
Yes, you have.
Okay, thank you so much. So I can nominate Agoth.
Okay, good afternoon, fellow change makers. Yes, as you have heard, my name is Agoth. Can I confirm if I'm being heard from your side? Please, the moderator.
Yes.
Yes, loud and clear.
All right, thank you. Yes, my name is Agoth Agwek Madut. I'm a youth leader and co-founder of Youth Uplift Network, which is based and operates in Kakuma refugee camp. In addition to that, I'm also an advocate for youth empowerment, basically to advocate for education of young people, promotion of their human rights and protections, as well as the general betterment for the community. So basically, in my organization, those are some of the focus areas that we dwell on. Yes, and that entails also life skill education, peace building, and promotion. So let me come direct into the headlines of today, which are very interesting. First of all, I would like to recognize that this important factor, all of us, we are eligible to mental health, because the world is not fair to us. The world is something that is challenging us each and every time, and trying to put us under the pressure to look into our issues on how we can put ourselves together. So let me go into at my own space, what work in my community, or the human rights that I have tried to perform, and how they have affected me mentally and emotionally. Now, I can say, first of all, it entails into two areas. First, I will start with the positive part of it. You know, this work, kindly bear with me. I might not be able to turn on the video because my network will not go through very well if I do that at the moment. So let us manage with what is available. So on the positive side, with my work on promotion of mental health, is that, you know, each and every time I do this work, interacting with young people, interacting with people who have come across various issues that have touched their minds negatively or has affected their performance, I feel that I'm making myself or selling out myself there as a champion, because I feel I have a purpose to do to others as well I do to myself. So it's actually motivate me that I am a champion. I'm a change agent, that I can do in whatever I have in my capacity and achieve that. So I feel like as an achiever, to contribute to the life of others and fight to overcome those trauma, stigmas, and mental health challenges altogether. On the negative part of it is that This is actually on the personal experience. I will sometimes feel drained or overwhelmed, especially working with the young people or the youth. And this one is related to drug substance abuse. And the most problem associated with is that most of the young people are now directing their attention or diverting their attention with the drug and substance abuse. And when you try to come up and also support these people, you find it is very difficult to at least reach a balance with these people because of either addiction, and they have maybe been neglected by their families, their lack of rehabilitation centers, and also some of them are very violent, you see, to at least give space for them to work together. So that is one of the most challenging part that I experienced throughout my work and with my team. But we haven't laid down our tools. We are still on the mission. So coming to the recognizing and managing secondary trauma, sharing the insight, you see, the first speaker has actually pointed out that this secondary trauma is the stress that is created from your first experience with that person who has been traumatized. So you see, most of us, especially in the CAM level, most of the people have a lot of challenges. Some have inadequate food, or let me describe it in a better word. Some are at poverty level. Some have suicidal thoughts. Why? Especially the women, because most of the people living at the CAM level, they are disconnected with their families. Maybe they are single parents or single mothers, and they rely almost 100% with the UN services. And when these services are inadequate, you see the child falls sick and can't get the best medical care. This invites in the room for suicidal thoughts. And it happened in 2023. There was one of the women who actually attempted. She has not been the first. Many incidences have been there. So you see, there are a lot of things that are there. And when you, as a mental health agent or maybe promoter, you go and interact with those experiences, you also feel sympathy and empathy. You also empathize with those people. And even sometimes you carry some to your own space and affects you at your personal level. Yeah, and it is really very challenging. So let me also come maybe to what of the self-care practices that are very important as that we can put up and put as underscore responsibilities that we need to do at our level as an individual, and also as we try to reach out to other people. Number one, I think that it is very important that all of us, as we are quick sometimes to judge others, we also live about judging ourselves. So it is very important to start every activity or every plan with yourself. So some of the most basic self-care practices that have worked out for me, and we have tried to put them into practice with my disciples that we have worked together, is for you to at least try to minimize finding yourself into mental health conditions or trauma, at least perform some basic tasks. When you don't allow yourself to be idle, perform some basic tasks, be it cleaning, be it maybe teaching young people songs or doing for them their homework. At least you find something to do. The moment you are engaged, you find yourself, you will have no time to find yourself having emotional damage. And that one has actually proved to work in most cases. Another important thing that you need to do is allow yourself to interact with people, and very stoicistic people, actually, you see, because these people actually, you will get experiences that you and other people share common issues or stories that all you have traveled along, and you will have to borrow something from them on how they manage the issues and have to move on from one fold to the another. So that one is another important strategy that is very important for you to keep into practice. Again, also we are in a digital world or era. So we have our mobile phones in our disposal. We have our television there, and therefore don't just close up yourself without trying to get information from the internet. Okay, if you're a person who can create content, be it a content that can make somebody happy, excite someone, or at least pass or share a certain information that actually can be life-changing to that individual. And actually, you have to do some exercise. The moment you exercise, all your body organs become active, and you will end up being a healthy person at the end of the day, mentally and all the rest part of the body. So because of the interest of the time, and already I've consumed a lot, I would like maybe to stop there, and I thank all of you.
Oh, I had failed to unmute myself. Thank you, Madut, for sharing, but you have a very important task of choosing the next speaker that you did not execute.
Yes, come up. What are you saying? Is there some?
The
Yes?
final part of your presentation is to select the next person who's going to speak.
All right. Thank you so much.
Yes.
Let me do that. I have my friend Polycarp Okeyo. Polycarp, if you can hear me, welcome.
Yes, I can hear you loud and clear. Thank you so much for choosing me to be the next speaker. So my name is Polycarp Okeyo. I work for Kisumu Shiners community-based organization as one of the co-founders and the current executive director. At Kisumu Shiners organization, we work for the sexual and gender minority groups who are in the bracket of the GBMSM and MSW. So when I say the GBMSM, that's an acronym, which is gays, bisexual men who have sex with men, and male sex workers in Western Nyanza region. So this is a very great topic, and it's a very, very important topic for us. Why am I saying this? Before I move to that, let me, so I'm a social scientist, and I'm also a researcher. I'm a counseling psychologist. I'm also a manager. So yeah, I'm wearing too many hats, but I'm very passionate about mental health. Why? Because it forms one of our strategic areas of focus. It is a great concern for our SGM. When I say SGM, is the sexual gender minority groups who are in the bracket. You might call them the LGBTQ plus and etc. and all that. But you've seen our primary beneficiaries of target are the GBMS and MSW. Of course, we do not forget about the entire LGBTQ plus spectrum, but our primary focus now is in the GBMSM and MSW. So mental health is a great concern. Why? Because of issues of stigma and discrimination. As you are aware that the issues of sexual and gender minority is still a concern in our community, and the law is also against it. So it's a struggle for most of our community members who have resulted to hiding in alcohol and substance abuse. And that has made them to be rendered useless as per the society. That has also made some of them to commit suicide. We've had a number of cases of people who have committed suicide. We've had people who are living in isolation. Why? Because they have been rejected by their family members because of who they are. And for authentically saying that this is who I am and I want to live like this. And I mean, you need to accept me and all that. So we've had cases of people being rendered homeless, and for those who are also married and are also living within the community and are married again, so we call them the bisexual men. They're also going through a lot of stress, a lot of issues within their marriages, within their lives, and that has also made them to have issues even within the family organizing. And you know very well in Africa, family unit is very, very important. It's not only within the family itself, but even within the community. So once the family unit is affected, then the entire community is also affected. So we've had a number of cases of young people indulging in irresponsible sexual behaviors, especially when they are under the influence of drugs and substance abuse. And that has also led to high increased rate of HIV and AIDS, new infections, which is very alarming. We've also had a number of cases of sexual transmitted diseases. And I also mentioned about suicide. And we've also had a number of crime rates. Why? Because as you know, once someone is addicted, then they really need to get intoxicated. And when they don't have any source of income, it becomes problematic, and they result in indulging in illegal activities such as stealing from people, among other things. So it is a great concern. And one thing that we did within our substance use support program, which is supported by AMPATH in collaboration with Kisumu China's organization that I work for, we realized that we do not have structures in place. We do not have rehabs that can be able to accommodate our people. So at times we provide the behavioral part of it and also referrals, but it's not really working out. Why? Because even the existing structures or the existing rehabs that are able to deal with those who are affected with alcohol and substance abuse, they are not enough. And for those that are there, they are for private facilities which are very expensive that our people cannot be able to afford. So you realize that most of the programs are not supporting that, and even the existing ones are very few and very, very expensive, which is a great concern and a huge gap that we really need to tackle as a community. So it doesn't match the number of cases of those of the mental health cases, yes, versus the programs supporting that. So that is a great concern that I think we really need to discuss even in this particular meeting and see how best we can be able to support our people, because we cannot do it alone. We need to join hands with different projects, with different programs, and see how best we can join hands and support our people, especially the young people who are being misguided and who are in dire need of support. Yeah. So another thing is the service provider. Even within the setups that we have, this service provider, they are not updated with the current issues. They are not well equipped with the issues of mental health. Psychologists, they are very few. The ones that are being funded by the government, they are very, very few. So that is also a great concern. So we really need to see how best to also provide resources just for our people, even the lay providers, to have that just basic component of how to deal with mental health cases. Because I know most of the programs that are existing within our organizations, we have lay providers. We may call them the case managers, we may call them the peer educators, but how equipped are they? We don't necessarily need to give them the technical expertise, but just the basic know-how of how do you ensure that our people do not reach that point where now they cannot help themselves, or how do we ensure that we just scan and know that this person needs help, as simple as that. So that is also one area that as programmers we need to look at and see how best to equip our people with the basic know-how on how they can identify and also conduct referrals and also identify options, the referral options, where our people can be able to be referred, because we cannot do it alone. So yes, mental health is a great concern. Stigma is still also a challenge. People who face mental health challenges are still being discriminated. They're still being stigmatized. And we've had a number of cases whereby someone decides not to talk about it. Why? Because when I talk about it, then it will even bring more stigma than when I get silence. And you see, when they keep quiet, the situation worsens and it doesn't get any better. So awareness is the way to go. And I'm happy that during the Mental Health Awareness Day, people came out strongly and they said, yes, listen, mental health is a concern and we cannot keep quiet anymore. We need to stand out firmly. We need to talk about our issues. And again, another gap is in regard to boy child. I'll focus on boy child. Why? Because my organization targets boy child primarily. So we've seen for a very long time, men have been seen as people who are strong, people who don't go through a lot, people who should just stand firm even when the situation is not good at all. But we've seen the current trends, which is very worrying, especially when our men are like, it's enough for us. I mean, we are also human beings. We also go through a lot of shit. And we really need to talk about this issue, and we need to be listened to, and we also need interventions to be supported. But yeah, so that is also one area that even when we talk about the boy child, then what interventions should we tackle, or how do we ensure that our boy child are not forgotten and are included even in these spaces? Yeah, so that is also one area that I think we will discuss in as part of this discussion, and see that no one is left behind, and that when we talk about mental health, then it is we have a holistic approach, and not just have selective way of doing it that is creating more harm than doing good. So yeah, in a nutshell, that is about what we do at the organizational level. We use the peer approach model, where our peer educators are able to reach out to our constituents and talk to them. At least they've been trained, they have the basic know-how, and yeah, they are also able to conduct referrals. But when it's really serious, then like I said, we do not have structures in place to address these structural interventions, or these cases that are beyond our control. So yeah, I'm really looking forward to listen to other speakers and also other participants, and see how best we can be able to tackle these menace of mental health, which is a great concern to the entire continent and to the entire world. Over to you, the moderator.
Okay. Thank you so much, Polycarp. I think when Polycarp you were speaking, I also noticed that you didn't speak about mostly your mental health, but rather the mental health of the beneficiaries of your project. And I have written so much from your speech, because I was thinking about just dealing with MSM, the group, and then dealing with male sex workers, which is a smaller group within a group. And then you touched on married male sex workers. And when you're speaking about everything the beneficiaries of your program go through, I think what was going through my mind is, how do you support a group that is that is socially deemed immoral, and you know that by you working in the group, you're also yoked with them. So the community sort of can isolate you because you have chosen to side with immoral, I'm putting it in quotes, you've chosen to identify with immoral people, and so you're part of them. So you are facing seclusion on top of dealing with a very sensitive group that is going through so much. And from the conclusion, I can tell that it is tough. And one of the things that I would have wanted you to touch on, which I think we will talk about later, is how you personally deal with it. I know you've spoken about how your beneficiaries, how you deal with it, peer educators, you've touched on service providers being given at least the capacity to deal with these groups. You've touched on boy children, but I would want you to touch on, maybe in the next session, to touch on you as the person that works with them. How do you take care of you? How do you take care of your team? How do you ensure that your team, after having someone in the program who relapses severally, after having someone in the program who commits suicide, how do you then show up at work the next day and still be able to help this group? I also liked so much Madhut's presentation. He talked about several self-care practices, people being overwhelmed by the situation and using drugs and substance. But he did talk about one thing, and that is building mental muscle, that by you placing yourself in the midst of helping these people that are going through so much challenges, you also build your mental health muscle in a way, because now you become the champion of mental health and the face of resilience, the face of overcoming all these challenges. But then again, it's a double-edged sword, because in the process of making yourself tough and also being that person that holds the fort, you also, as Haron had mentioned earlier, you also tend not to put your guard down, because you have to be the face of strength. You have to be the person that is holding everyone. So if you let go, what happens to the entire group? And Anne talked about the psychological first aid and just having to hold so much heavy stories. I think from my own experience working with girls in the community, sometimes you go to school, you sing with the girls, you dance with them, you have a mentorship session, and then that girl tells you they don't want to go home because maybe they're going to face physical violence, maybe they're not going to eat that day. Sometimes you are sleeping at night, they call you, they text you, and you know very well that you're not able to help them in the way that they want. And it feels helpless, but also it gives you sleepless nights, because you know that girl is not okay. You come to the program the next time, you can't see the girl. You cannot reach their parents. You know something is happening to the girls, and yet you feel so powerless. Sometimes you don't even have the resources to say, let me take, wacha nichukue gari niende nimtafute. Sometimes you don't even know where they live. Sometimes, you know, with the border, with the Kenya-Tanzania border, sometimes they've crossed over to the border or they've gone somewhere else, then they come back. You don't know what happened to them. You don't know whether they underwent FGM. You don't know whether they were married temporarily. You don't know if they ran away with boyfriends, because it happens all the time. And just having to hold those heavy stories when you're eating, when you're sitting with your family, when you're sitting with your friends, you still remember, so and so, that girl called me. I was not able to help them. That girl told me that they were going to face this thing, and I couldn't take them to my own home. And I don't know whether it happened and she didn't tell me. I don't know whether she's lost hope in school. So it can be very heavy. And one of the things that I would want us to touch on in the next, maybe I'm going to give you one minute or 2 minutes to touch on. We talked a lot about the mental health issues, but how do you identify them? How do you know that you are going through a mental health overwhelm, that the work is becoming too much? What are some of the signs that ukiona hii, you just know, hapa, something is happening, I need to seek help, I need to take a break, I need to do something about it? What are some of the signs and symptoms? We'll go in reverse. So we'll start with Polycarp, then go to Madut, then go to Anne, then Haron, and anyone else in our conversation today in this Zoom. You can add it on the chat. You can raise your hand. If you have questions, please write them down. You can still type them, but in the end, I will give you an opportunity to ask questions and share. So in one minute, how do you identify? What are the signs? Was I muted the whole time?
We can hear you.
Polycarp. Okay, so I said we start with Polycarp, then Madut, then Anne, then Haron, and anyone else thereafter.
Okay, so thank you so much for that. I think I'll start by responding to the first concerns, which you said I didn't mention about myself. So just to clarify, when I talk about the community, I am part and parcel of this community. So when I refer to the community, I also refer to myself. So as being part and parcel of this community, it is besides that, you see, besides being a part of the community, again, you are a leader. So it is very, very challenging, because people expect you to be their role model. People expect you to be their Jesus. People expect you to be their God. And they don't want to see you weak. They always want to see you strong. And they always want to see you tackling their issues, even in the wee hours of the night. You can imagine how stressful it is. So being a leader is also one thing. It's not also very easy, especially in dealing with diverse people from different walks of life, people who have different issues. So at times it's overwhelming, it's too much, especially having these cases, having these, traumatic cases whereby people present their issues, and some of them are sad, some of them are too much for one to even try to digest and all that. But it keeps us going. Why? Because at the end of the day, yeah, we really need to do what we need to do. So one thing I've learned to do, it's my own self mental health. It is very, very important. At times I just decide to have my own time to have a meeting with myself, to think, and at least to also to relax. It is very, very important, because I realized that I was really, really concentrating too much on people and forgetting about myself, which was worrying. Because when I reach a point whereby it was too much, then I was useless. Like, I couldn't help people, because if my mental health is not taken care of well, then it means I'm not able to also take care of other people's needs. So I realized there was a need for me to also have to work on my mental health, to relax, to rethink, to have a meeting with myself, and come back strongly. And that has really helped. And also, it has also helped my team, because we also deal with a lot of issues, and we are also humans. Besides being employees of that particular organization, besides being human rights defenders, among other things, we are also human beings who go through a lot of issues. So there is need for us to also deal with our own issues before we can deal with people's issues and all that. So yeah, that brings me to your question on how do you know this person has issues. Within our own initiatives or interventions, we do have a model, and this model is well structured, where we have an assessment tool, and within the assessment tool, we are able to understand that this person needs help. But again, some of them are beyond us. They need to reach out to psychologists, counseling psychologists, or or a healthcare provider, in order for this healthcare provider or service provider to be able to assess and to rate this person and refer for various interventions. So within our own capacity, we are able to look at the checklist and do an assessment and rate whether this person needs to be referred for further help, or whether this person or we can do it within our own capacity. Yeah, so our peer navigators, our lay providers, they are able to respond to just the behavioral component, and to give them the information, like, you need to do this, your mental health is very critical, you need to take care of it by doing this and this and this, engage in other activities, etc. that you know. Just to give the information. But then at the end of the day, the clients, they understand themselves well more than you know them. So when they are able to present their issues and tell our lay providers that we need help, then at that point we are able to refer them for help in our facilities that we work closely with. And these people are at the facility level, they are well trained, they are able to assess and assist these referral or the referred clients for various interventions. Over to you.
Thank you so much, Polycarp, for that. I don't know, is this assessment tool open, an internal tool that you just use with your beneficiaries, or is it open to what is it called, other activists?
Also,
Just a
this is
quick
our
one.
own tool that we designed for our own programming. So it is
Okay.
just like, just like I'll ask you, what is your name? When was the last time you had sex? Have you understand? So it's just like, that's an
Yeah.
example. It's basically a tool to assess the rate at which this client is need help
Okay.
or referral.
Okay, thank you.
Yes.
Sawa. So over to you, Anne. What are some of the signs and symptoms that this is the mental overwhelm you're going through as an activist or human rights practitioner?
Okay, thank you so much. So in mental health, there's something we call the mental health continuum. This is like a line, or like a scale. The scales we use for grading or assessing people. These are a mental health continuum that we use for our clients to know where they are at. So if you're having a bad mental health state, you'll be on the lower side of the continuum. If you're having a good mental health state, you'll be on the upper side of the continuum. So clients come with different issues. There are those who you will assess and see they have changes in behavior. That is, they complain about they've not been sleeping, they've not been eating well, or others have been overeating, others have been oversleeping, others have high stress levels, and there are others who will come with changes in feelings, how their feelings have been fluctuating from feeling overwhelmed to feeling happy, from feeling sad to being joyful. So changes also in feelings can indicate that someone is going through something. His or her mental health, it's not balanced. Because for a normal, let me use normal human being, you are supposed to be in the center of the continuum. But when you are having now the bad side of the mental health, you're going to the other side. So the other thing is changes also in thoughts. You start having irrational thoughts, you are hallucinating, you have different kinds of thoughts. So for me, I would say for the clients we've seen, and for also for me, the symptoms to know that someone has been affected, or his or her mental health has been affected, is you look at the changes in behavior, you look at the changes in thoughts, and you look at the changes even in feelings, and even how the outward presentation of that person or that client is presenting him or herself. Yes.
Awesome. Thank you so much for that. So she's told us some of the changes that are not eating, sleeping, fluctuating feelings, changing thoughts, hallucinations, behaviors. I think some of these things I have seen within my team and even within the community I work with. I remember one of the mental health assessor that came to see us and said, tension is first felt in the body. And she drew this anatomy of a human being and said, if you feel it in the stomach, then this is what it means. If you feel it in the hips, if you feel it in the head, this is what it means. And I don't have the diagram here, neither do I have it. Do I have a photographic memory of it? But I do know that when your body feels stiff, when you feel exhausted, you don't want to show up at work, you're cranky, you don't have the usual energy. And not, of course, some days you have good days and bad days, but if continuously you don't have the energy and the will to do the stuff, it might be a sign that you're going through a mental health difficulty. Madut, quickly, 1 minute, then hand it over to Haron for the signs and symptoms.
Thank you. I think the previous speaker, Anne, has actually mentioned very critical symptoms that actually we can easily identify from those brothers and sisters whom are going a lot. And on my part, what I can only contribute is that one of the symptoms that you need to also check out. You see, most of us actually are not experts, maybe psychologists experts or reproductive health experts, but at least we can appreciate in one way or another God has given us some wisdom, natural wisdom, we can quickly discern some of the changes or abnormalities. So one of the things is disassociation. You see, if you get to monitor someone either within a household or within an institution, and you find there is a slight this association of that individual with friends, you see, colleagues, or even family members, and then you really need to pay attention. You need not to be ignorant, because that is one of the signs that something must have been wrong somewhere, and it is one of the things that I would like to add on. Of course, the first speakers has mentioned a lot of things which I also agree and support. Now, coming to some of these steps or action points that we really need to take after identifying these symptoms is, sometimes the individual, especially we can take, for example, if a person is sick, this person has to be accorded support. You see, the sick person will not always be at the front line, either to eat or to push herself to go to the hospital. So we need to seek external support. And one of the ways is for us to identify these people is creating an awareness of the existence of mental health within their families, within the communities, and how can we do this? We can do this through forums. Like if it is education, children in school also has to be involved through those sessions. If it is a workplace, the senior managers can also take up those responsibilities and also create that awareness. And also, home care is also very important. The heads of the family actually have to be the eye of that particular family and watch over everybody, including the wives and the husband. So that's what I can add up to that point. I think my minute was only 60 seconds. Thank you.
Hi.
Thank you so much, Aaron.
Awesome. Thank you so much. It's like you guys, you're talking about my symptoms I've been feeling about. Oh my God. Are we sharing only symptoms or also with a coping mechanism?
You can share with a coping mechanism, because I see time is not so much on our side and we still have one more session to go through.
Okay, so thank you so much. From my side, some of the symptoms I've been observing. One of the major symptoms is about loss of interest and motivation, and it's more of a I can have that kind of a high energy. Niko na hii kitu inaitwa bipolar disorder. Sometimes niko na very high intense energy alafu inashuka hivyo. So most of the time niki lose interest in something which I love to do. It's one of the symptoms like something is not going on well. Sleeping issue. Sometimes usually have difficult of sleeping, those kind of nightmares, insomnia, or sometimes I sleep a lot as a way to escape that situation. So the moment Nikki realized this, I realized that I'm having some mental issue, and it's my time to do a self-care. Also, the anxiety part of it's one of the major issue, feeling worried about my safety, or sometimes having like I just kukua na ile wasiwasi tu so anxiety nikifeel to hiyo. And one of the major thing I have observed from my side, it's more of a social withdrawal, isolating myself from friends, isolating myself from family, colleagues, because I feel they don't hear my situation. I'm trying to share my story, but they don't kind of acknowledge it, or they keep judging. So I feel like disconnecting, it's one of the things. Or sometimes difficulty of forming professional relationship because of the trust issues. Sometimes you have this kind of a trauma, maybe you have been experiencing mistrust issues, so you're still afraid like this person will kind of do the same thing. And sometimes this happen a lot in the relationship part of it. Yeah, then the last part of it's about self-doubt, doubting yourself before doing something like am I enough to do this thing? Am I capable to do this thing? Imagine you've been doing it for a while, but now you're doubting yourself. These are some of the major issues. But at individual level now, me as Haron Madena Miesi, how have I been coping these issues? One of the things I had to copy with these issues is about establishing my boundaries. I had to create a very strict boundaries. And from my side, I have 888. Like I have divided 24 hours into 888. 8 hours for sleeping, 8 hours for working, 8 hours for personal issues like cleaning, cooking, blah, blah, blah. So it have really helped me to do my work. Peer support networks, it have been working so critical, surrounding myself with like-minded individuals and seeking support to those people whom I know they won't judge. It's very critical. I think I have engaged with you guys in some of the way, and it have really helped within our network. Another part is about structural self-care routine. I have a very structured self-care routine. For me, Nick, on a very strict routine that Monday to Thursday is purely work. I don't need friends. And Thursday is my outdoor engagement, doing shopping. Saturday is for networking, meeting with friends. And Sunday is purely about sleeping. It have really helped me a lot doing this as one of the self-care. And also limit exposure to triggers. By the way, one of my therapists told me I need to document my triggers. Which are these things which triggers you? And one thing about which triggers me, I realize I'm that empathetic person. I'm that person. When I see you posting something status that you're struggling with something, I must find ways to help you. And if I don't have money, I'll take loan to help you. So at the end of it, it keeps hurting me. And because of this trigger, I had to leave a lot of social media. Like I'm not active Facebook again because it triggers me. I had to deactivate my active WhatsApp number because those WhatsApp status used to trigger me. And also I had to isolate myself to things which really trigger me. So identify your trigger as a young leader, as a young human rights defender. It's so critical. And also we had a conversation with Elsie, and she told me one thing as a human rights defender, you need to document your work, all those issues you are facing, document them, and then use those as evidence to make informed decision. It's so critical. So as a way to limit yourself to trigger. Lastly, seeking professional counseling. I understand sometimes it's so expensive getting experts or getting counseling, but also you can just give it a trial. If you know some, I remember last year I was starting my role with one of the clients, and I had to tell them about I was struggling with trauma, with the suicidal thoughts. So I had to tell them openly, like, you know what, I'm struggling with ABCD, and I don't want to transfer this trauma to my teamwork or to my colleagues or to you or to the whole team. So you better help me to deal with this trauma, or I just have to resign from this job. So by being me and being authentic, my boss had to take me for a therapy session. That was my first time to do a therapy session at Kiromo Mental Health. And I am surprised. I thought I'll see crazy people there, but I saw people with ties. People are so hell. I'm like, oh, yo, seriously? And that was my first time. So mental health is not for crazy people. Everyone's struggling on his or her own way. Yeah, so these are some of my coping mechanism. I know they help someone else. Thanks so much. Back to you, Elsie.
Shukran sana. Thank you so much. I think everyone has touched on a point that someone else has touched on at some point. I see we have about 10 minutes to the end of our session. Maybe we'll extend it. But I wanted to just reflect on what all of us have shared about the triggers, about the coping mechanisms. But before I reflect on that as we close, I want to throw in a different aspect of these mental health issues. I've seen NTV did a feature on toxic work spaces yesterday. But one of the things that I've had people constantly say is the place where you will get most of your human rights violated is in a human rights organization. That we as activists, community changers, human rights activists, we focus so much on fighting the government and fighting everyone else that is violating human rights without recognizing that we also have a responsibility of protecting the rights of the people around us. So you find that your boss that is getting awards for changing communities is the boss that is also making miserable at work, that your colleague that is talking so passionately about women and girls' rights is the one that is making your life so miserable at work. So I wanted us to share about how do we build a positive work environment for all of us? One. Two, how do we build communities within ourselves? Because I understand that part of the self-care is building a community within each other and outside each other. But I wanted to focus on the internal part. We as people that work together, how do I make sure that I'm not sabotaging Haron's work in such a way that Haron is now miserable because of me and I am a community champion? How do I make sure that Polycarp is okay, even though I don't know Polycarp that much, but I know we work in the same space and I can see his status all the time. And I can see these indicators, the way he's speaking, the way he's expressing himself. I can tell that something is wrong. How do we build those internal networks? And how do we also ensure safe spaces for all of us? So maybe if we can respond to that in any manner, I will not say each of our speakers, but anyone who's willing to speak on it for about a minute or two, and then we can go back to the final session.
Let me start. Thank you so much for bringing that in. Toxic working environment, it's a great concern. I don't want to say in the human rights work alone, but in all the areas, whether in government, but even in the NGO setup, it's even worse. Why? Because of the donor supported projects. And these donor supported projects, most of them comes with a lot of pressure, and that pressure comes from the donor, it trickles down to the director, all the way to the program manager, and up to the last level of the field assistants. So I can't say I'm really perfect, but we have really tried as much as we can within our own organization to try to have our own. It starts with the self-awareness. You as a person, do you know yourself? Do you understand yourself? And do you understand your weaknesses? Do you understand your strengths? That is the most important thing. You will not lie to me that you want to understand your junior staff if you yourself do not understand yourself. That is a big lie. You first of all need to understand yourself well before you can be able to understand yourself. And once that is achieved, then you will be able to relate well with the rest of your colleagues. You'll be able to have a proper way of work. You'll be able to work in a well-coordinated way, well-organized way without having a lot of pressure. But like in the NGO world, it is still a struggle. And you even bear me witness that if you go to airports, you'll see people not even having time for themselves to relax. Everyone is rushing looking for internet, looking for Wi-Fi. People are having laptops on their laps. People are busy. It is crazy. You go to a meeting, people do not even concentrate fully. They're busy on their laptops. You go to social gatherings, people are not even having time for themselves and with their families. They are busy on their phones, they are busy on their laptops, responding to emails and addressing work-related issues. So it has brought a lot of mental health issues because the social bit is very, very important. However much we are trying to meet these deliverables and to work for a living in it and all that, but there is that social component which has been lost. It is very, very critical, and we've had a number of cases, mental health cases, because of that. So we concentrate so much, and the end result is the mental health issues. So we need to balance. We need to know, just like Haron Mwadena mentioned, that he has filtered it. 8 hours rest, 8 hours work, 8 hours social. I know we do not have a one-size-fits-all approach in all this, but you as a person, after that self-awareness, are you able to understand yourself? Are you able to understand your patterns? Are you able to come up with a plan to enable you coexist well, to enable you do your work well, to enable you achieve these deliverables without necessarily putting too much pressure on yourself and on us and others? Thank you, and over to you.
Thank you so much. Anyone else who wants to touch on it? That was very informative and comprehensive. You can still type on our chats if you have anything to add or a question to ask or anything that you would want to hear from the speakers as we close. Maybe I would want to share, or I would want us to to take a plan today as we leave this meeting. What can we do as a collective? And here's where I would want everyone to contribute at least a point. Like, what do you think we should do as a network? I know now we have about 10 participants. I think some of them are in the network, some of them are not. But I want to know, what is one commitment that we can make coming from here today? We have talked about the science, we've talked about the symptoms, we've talked about how our own experiences have been and how we can check each other internally and personally on a personal level. But I want to know, as a collective, as a community, what is the one thing that we can commit to doing after this meeting? Or what are your suggestions on how we can build it? I think this would be very instrumental to our network weaver. Mr. Haron, yes? So what is the one thing you think we should do as a community to help each other overcome these mental health challenges, and especially secondary trauma from the work that we do? The floor is open to anyone.
Awesome. Maybe just start quickly. Actually, I was prepared to answer to the previous question which Polycarp answered, but I can merge with this to be one thing because it's just kind of a party shot. So what I would like to share, we as young human rights defender and youth activists, we need first to, before we even think serving humanity, it to start with us and those around us. That's a very critical thing. And three quality of leadership which are so critical. One is kindness. Let's treat each other with kindness. That's very, very important because you never know what's your colleague anapitia. So treating each other with kindness is also critical. Empathize with your colleague without judging. Listen to your colleague, empathize with him or her, and see how best you can support. Sometimes support it's not about financially, maybe some tips, yeah, or just giving that that person to share everything and giving you a thought without judgment. It's so critical and very, very important. Active listening. Listen is one of the critical thing I've learned a lot from my current role where I'm serving, and that's one of the core value of that organization. Listen, listen, and listen without judging. It's a very critical thing, especially when you are dealing with the marginalized young leaders. Majority of us, we have seen it all. We have experienced the worst part of it, and what we need is just someone to listen and just give advice. That's critical without judging, because you might judge us, and maybe the more you judge, the more you escalating that issue. And let's try our best not to be the cause of someone to commit suicide. And my last point, it's about from my side, as my principal, I I have a policy where there's no one should volunteer with me. Every young person deserve dignified opportunity. So if young people are coming to you, they want to volunteer with you, think about the win-win approach. As this young person is giving her time or his time, how are you helping back? You see, creating a win-to-win approach, it's one of the critical part of it, and it's very important. So let's say no to unsustainable volunteerism, and let's collectively promote sustainable volunteerism and find ways how we can support our colleagues in one way or another. Yeah, these are my very authentic and deep feedbacks. And thank you so much. Back to you, Elsie.
Thank you so much, Haron. I think when you were talking about volunteering and that young people should be appreciated for their talents, I kept asking, I kept in my mind, I kept reflecting on how much I've volunteered all my life. And sometimes I volunteered for organizations that had money, but sometimes they didn't have. And one of the struggles I've had with my own organization is you want to hire interns, you don't have the budget for it. You want to say, I don't want to give these interns work and then not pay them. So there's that financial challenge where you not intentionally want to use them, but that is how it comes off. And I remember one of the LinkedIn pages, an organization in Westlands was hiring someone, and they had put so many responsibilities and roles for 30,000, and people really went off in the comment section saying, This is using someone. How do you pay someone for 5 rolls, 30,000 Kenyan shillings in this economy? So sometimes it's the financial challenge, and I don't know how to go about that. But if anyone else has tips on how we can manage this as a community, please feel free. I'm keeping it open for the next 2 minutes. Anyone else who has more tips?
Okay, so I would start by first saying I've had 2 people use the word commit suicide. As a mental health advocate, you're used to create awareness on the words to use. So I wanted to correct that. We did not say they committed suicide. We say they died by suicide. Simply,
Okay.
that person did not want to commit to suicide. He or she wanted to end the pain just by dying. So we don't say committed suicide, we say died by suicide. So for me, what we can do maybe in future, we can have something we call like buddy systems. Buddy systems is like we pair up, we get groups of people, like groups of 2, group of 3. We someone who you can share to when you're feeling overwhelmed and maybe you don't have the resources to go to therapy for. Like for example, you can share you can partner me with Maureen. Then because I don't know Maureen into details, maybe I'll feel safe to share to her what I've been going through. You can share maybe Harun and Poricap, and they'll have like a buddy group for men, and they'll talk men issues. So I think in the way forward, we can have like body systems where we can have like safe spaces where we can vent out and talk our issues without being even going for therapy where we don't have resources to go for therapy. And the other last thing would be a safe support group. Like the 10 of us, we can just purpose to be safe with each other. Like when I call Harun and share with him what I'm going through, I'm very confident that he won't share with other people out there. And this would be like a safe space for us. So thank you for that. And sorry for the correction of committing suicide. It's dying by suicide. Thank you.
Okay. Thank you so much. I really appreciate that correction. So we say the person died by suicide and did not commit suicide. And I really think your recommendations are very useful. The buddy system, I think I've used, the first time I interacted, I was doing the Strasbourg community service, and I saw this buddy system where you're tied to one person and you must know what they like, and you must know who they are, and you must know how they are doing. And then at the end of the camp, you must buy them a gift and then say something good about it. And it really elevated people's moods and perception of themselves after the camp. So I really like these buddy systems and even sharing as a group. I don't know if this is something you can do, Haron, but maybe we can do this on a regular. Once in a while we just meet as the network and then just share experiences and our journeys and how we are doing. Anyone else who wants to share something? I've shared a document on the group. I think it's for attendance purposes and for reimbursement purposes. Please make sure you fill in your details so that I am able to follow up on that. Anyone else that wants to add anything? Our speakers, our listeners?
Okay, maybe to add something quickly.
Yeah.
For
I'll say
those.
something.
Oh,
Okay. So
sure.
Maureen first, then Haron.
Yeah,
Please
Maureen,
go ahead.
proceed.
Hi.
Hi.
Aaron, thank you for allowing me to go ahead. Sorry, I didn't hear you talk. So I'm very pleased to have joined the meeting. However late, I'm so sorry. My timing was a bit off today. I want to start by saying I know Harun and I think he's an amazing person. And I feel like whatever he shares is very intentional about it. And it's also very dear and close to my heart. I'm like, today I was talking to my boss. There was a lot of lack of clarity in terms of like my situation at work. And so I made a call to and we were talking, and I feel like there's something you've touched on with regards to like how your bosses treat you, mostly especially in the NGO space. And I feel like today I felt like a victim to some degree, and I ended up saying I ended up it was irrational, but then it's something I had thought about for quite some time, and I told them I don't feel like that's the space for me, and I think I need to look for another space. So tonight I don't know whether I have a job. I think probably my anger got me jobless, but then again, it's still okay. We'll figure things out. But I also feel like whatever you are discussing and what his name is Polycarp mentioned came too close to my heart, and actually I appreciate this session because it also helped me to like look at things in a whole different spectrum, and also be acceptance that there are some jobs and there are some bosses who don't technically and tick your boxes, which is also okay. And I also feel like being too expectant in the field that we are in, which is the non-governmental space, you end up being disappointed too much, and then that will cause a very huge issue on your mental health, and will probably give you depressions and hiccups in the process. But having a space like this that I've just discovered through Harun, actually, I really appreciate it, and I also hope that I'll be able to join in on these spaces as well on the side. I really, really need some support in terms of like the mental health side. Thank you so much.
Oh, thank you so much, Maureen, for sharing. I'm really sorry about what you are going through today. I think employees don't just snap in one day. It's an accumulation of so much stress and so much held up tension and feelings. And then one day it just goes off. So you shouldn't feel bad about what happened today. I think you are rightly so to express yourself. I think whatever the outcome, you have a community of support. Thank you, Haron, for creating a community of support. Just her saying you're very intentional, and I could see you smiling. We also feel very good when we are appreciated for the work that we do. I'm really sorry once again for what you went through today and what you've been going through at work, and anyone else who might be going through the same thing but silently not speaking about it. I think I've been in the same situation, taken mental health days, taken sick leave, quit jobs, you know, so many of those instances. So over to you, Haron.
Oh, awesome. Thank you so much. You guys are making me blushing here. Oh my God. Okay, thank you so much, Elsie. And concerning the buddy system, it's one of the best idea. Thank you so much, Anne. And I think Anne can tell you the way I've been pushing her to join some of the hikes engagements. And lastly, she had to tell me, hey, how do you know what? I cannot manage because of A, B, C, D. And what we are trying to do is to build a kind of a ecosystem where we as young leaders, we support each other rather than judging each other, bullying each other. So I've been seeing all for the last 10 years, and things are even worse. And Maureen, I'm so sorry for what happened. Just to be open, authentic with you, that's just the beginning. You have not seen it all. I'm not trying to threaten you guys, but I'm trying to show you the other side is that these things happen because we are dealing with human beings, and these human beings have emotions. So what we need to do is to find ways how to manage the diverse groups. And the best thing I will recommend to you guys is be authentic and share those issues. For me, whoever engage with me, I usually share everything. You will judge me, I don't care, but I already shared it so that in future don't say I've not shared ABCD. I usually speak everything. If you can help, it's okay. If we cannot help, it's okay. But that's my way of expressing myself. Yeah. So lastly, just one of our key takeaway, what we are doing apart from the network issues, we have every weekend we have engagement, the Changemakers hikes and adventure. And if you're in this call and you're experiencing this kind of a mental health issues, I would like to encourage you to get in touch, and we will give you special support. Our side, we don't prioritize money. We are not here to make profit. And if I'm here to make profit, these engagements won't be cost the way they're costing. And most of these engagements I've been using my own resources because I know how it felt to be a young leader. So I'm giving some free tickets for those who are specific in these calls. And maybe if you are in Nairobi, perfectly. If you're not in Nairobi, don't worry. We are coming to your regions very, very, very soon, targeting Mombasa, Kisumu, in Nairobi. Those who are at a refugee, at Kakuma refugee camp, please also get in touch. We will help you to coordinate everything. The only thing we need is someone on the ground to do those actual work. Yeah, so these are some of the good news for those who join this conversation. We are here to support each other. And lastly, you need to know as a young leader, there's a trend going on that the funding within the civic sector, it's so shrinking. In the civic space already, it's so shrinking. Those who are in Kenya, due to the Gen Z protests, most of the donors, most of the development partners are so kind of afraid funding the civic space, especially the youth activists, because they are so afraid that if they give us resources, they're giving us powers. And the more they're giving us powers, there's a possibility that they will positively impact young people. And the more young people are being exposed, the more they're demanding for their rights. And that's how our senior are kind of freezing these resources. But this does not mean that we should stop doing the amazing work. This means that we need to keep innovating. And that's why we had to shift from donor revenue engagement to revenue-based engagement. All of our engagement are being funded by fellow young people, and we are using this profit to giving back to support each other. And I believe by doing this, we are building something known as a relational approach. And that's so critical by investing in some relationship. Yeah. So lastly, Maureen, you can get in touch with Anne. Anne, I know she's a therapist. Get in touch with her. Maybe if you need support and talk with her, maybe she can give you support, advice. And then Anne, feel free to get in touch with me. Nyuma attend after dealing with Maureen. And yeah, that's how we keep supporting each other. Yeah. Anne is part of the network. Maureen is part of the Changemakers Hikes. So you're all part of this huge family. Thanks so much. Back to you, Elsie.
Okay, sawa. Thank you so much, Haron. I think what I wanted to share as my closing remark has been shared by everyone, and that is building a community within, building a community outside, safeguarding and protection, like just having internal mechanisms of you have sick leaves for your employees, you have working from home, you have working remotely. If you see a colleague looking overwhelmed, just help them out. You have I don't know what channels you formed within yourselves, but that sort of thing. You also have reporting, like in the same way Haruna said, or Maureen, get in touch with, and just realizing that when you don't have the capacity, but I can refer you to so and so, I can refer you to so and so who can help you. I have seen countless times other groups. I know, I don't know if all of you are familiar with Rick's Poet, Adele Onyango. I've seen them do group therapy sessions. So that's also could be another intervention where you just finance. I don't know how you finance it, but you bring a therapist that can talk to a group. And that is also a facilitation of just sharing and then just having that expert deal with, use their expertise to deal with whatever people are going through. But one of the major things that we did at G4Girls, which I think has been very instrumental in our work, this is a concept that I learned maybe a year back before we started our program, and is budgeting for mental health in our budgets. Like, unaona ukiweka activities, you have so many activities. I don't know, we are going to school, we are going to here, we are going to do this and this. But one of the things that we introduced is psychological support for our employees. So what that means is we have partnered with a mental health providing service provider. So for every beginning of the month, each employee receives a voucher for 2 sessions, 2 mental health sessions. You don't know, we don't know who you're talking to, and the voucher does not have your name. So people just go to sessions when they need, but you have at least ukona sessions mbili in a month to speak to a psychologist or therapist regarding anything. And then that helps you if you cannot speak to the group, or if you don't have any other support system, at least you have the therapy sessions. Sometimes we're supposed to do yoga sessions. So we had partners with Yoga for Biodiversity and Yoga Africa project, because I think one time we did that the group therapy, and when we're talking about body and the way tension is stored up in your body and trauma is stored up in your body. And I know Africa Yoga Project does that. So one time we call them over, and we've been doing this through other organizations to help us out in the communities that we work. So that is the tips I would share today, and I would want us to, I think I have collected so much notes, sijui kama I will have to make a document and then share it with us, because I feel like we shared so much useful information, and it should not just end here. I see Maureen also says the Hindu Council has free yoga and free yoga mats. So if you needed that, you can do that. Haron is saying we are planning to start a pizza movie Fridays for Nimoto. We have pizza movie Fridays for our members as part of the monthly buddy system, just for psychological support. And don't forget to take NHIF. We still have NHIF ama tuko na ile ingine, the controversial one.
Yeah, hiyo. I think it's only 500 monthly, and I think niliona wako na package ya mental health. So ukikuwa na hiyo card, you can go to kama kwa these hospital and get services. Yeah, so let's prioritize self-care, guys.
Okay. I see Maureen also says she wants to join the network. So Haron, that's your over to you for that. And oh, thank you, Madut. Madut has said the moderator has been wonderful. Thank you so much. And Polycarp says it's SHIF. I don't know if it is legal, but I've seen that people have been forced to go on it. So you can go on it. So to the Social Health Insurance Fund. I think it caters for something of the sort. So I'm going to give all of us, because we are even way past time. So I'm going to give each of us 1 minute or two, everyone that is in this meeting, because we are just 10, closing remarks, final thoughts, one minute, then we close off. Let's start with Polycarp, Anne, Maureen, Dr. Mohammed, Madut, Korodi, Akinyi, Frankenstein, then we finish with Harold. 1 minute, please.
All right, my parting shot is that mental health is real. Let us have interventions within our programs that address the mental health issues. Most importantly is self-awareness. Take care of your mental health first before you can be able to assist someone else's mental health. It starts with you before you can be able to support the other person. Let us involve in mental health interventions, and we will be able to see a change that we want to see. Thank you.
Mm-hmm.
So thank you so much for having us. And for me, I would like to tell everyone, or if you're a believer of Christ or a believer of, everybody has a different higher power. For us Christians, in the beginning, there's someone who mentioned Jesus. Yani we huwezi kuwa Mungu if Jesus alishindwa na kubeba mizigo za watu wote. Yani have limits, because you won't be able to help everyone. Because when you be like, if you want to be that person, yes, we are doing charity work, we want to be very empathetic, we want to help and impact as many lives as possible. There is a point where we can break. So let us have boundaries, let us have limits, and let us know that we cannot reach to everyone. For the impact we are able to do, well and good. As little as it is, well and good. At the end of it, just know that you're not Jesus, you're not Muhammad, you're not Buddha, you cannot help everyone. So from me, cheers, and thank you for having me. Thank you.
Thank you so much.
Thank you again for allowing me to speak. I'm Maureen. I work in the space of peace and security and climate change. I really, really appreciate the opportunity to have attended this session. I feel very, very sad that I came a bit late, and I feel like I really needed to listen in from the beginning. I don't know whether you are recording. Maybe you'll share the recording, hopefully. But
Yes.
besides that, thank you very, very much. There is need to also organize mental health sessions for people in these like spaces, in like NGO spaces, because man, it's stiff for tough. So if probably you can schedule specific ones for people in our spaces, I would really vouch for that, and I would 100% support. Thank you so much.
Asante sana. Yes, we are recording and we are going to share this to everyone.
Hello, I'm happy that we are reaching the conclusion successfully. What I would like to bring forward is that we would like to encourage everybody that all of us have a role to play. But as much as we do that, of course, let us identify that we cannot work by ourselves or we cannot do it alone. So let us look at ourselves as opportunities, let us cooperate, let us share and create this impact together as a team. So in that way, I think we are going to achieve more, unlike than fighting and sabotaging the work of each one of us. I think with that one, we're going to realize more than having fighting each other down there. Thank you so much.
Asante sana. Oh, thank you so much. I assume all of us speak Swahili. Thank you so much. Asante. Thank you. Next person, Samuel Onyango. We would love to hear your voice. Safin, we would love to hear your voice. Dr. Muhammad, we would love to hear your voice. Perpetua Korodi, if you're willing, we would like to hear your voice.
Am I audible?
Yes, you are.
Good day. Happy International Day of Girl Child, and thank you all for having here. I'm ever grateful to you for having such an amusing and informative session. Such sessions should be maintained continuously. As physical health, people care for physical health. They do not know how much they are suffered from mental health. It is very necessary for everyone to take care of their mental health. Thank you very much.
Thank you so much, Dr. Muhammad, and thank you for reminding us that today is the day of the girl child.
Okay, thank you so much for the fruitful discussion that we've had. I've really learned a lot on matters around mental health, and I don't take this for granted. What I will really concur with is the buddy system or the wellness system, where we can team up, everyone to have their person who they keep on checking up on a daily basis, so that in our network, we don't have instances of suicide and depression. We start with our own self, with what we have, and of course, to do what we can do. And then I also love the aspect of collective responsibility. We don't have to point fingers at everyone every now and then. Actually, this one is the one who did that and that. We have to face all the matters around mental health through collective responsibility approach, because at this juncture, we have to normalize the conversations around mental health, because I know we are losing like a huge number of young people through depression and suicide. Yeah, thank you so much.
Thank you so much, Safin, and thank you for reinforcing and reaffirming the buddy system. Anyone else have locked out that would like to speak? Okay, Haron, closing remarks.
Oh, awesome. Thank you so much, Elsie, for organizing this engagement and for supporting our fellow colleagues. From my side, I'll just share that it's okay not to be okay. And also, I would like to emphasize that change starts with you. I know sometimes the African system, it keeps telling us to focus on our mission, to empower others, to make changes, to transform community, to make this world a better place, blah, blah. But no one is talking about you as individual. And if you've been observing my approach or our approach as a team, we've been focusing more to prioritize more of people than programs. So my challenge is prioritize your interests always, and always address your issues. If you feel tired, stop. If you feel you want to rest, rest. Don't try to push yourself so hard. Make sure first you're comfortable, you are sustainable, and you're mentally stable before you give that. See? So I have this quote which I usually say that charity begins at home. And when I say charity begins at home, it means charity begins at yourself first, family, and then extend it. So charity begins at home, but it should not end there. So thanks so much, and back to you, Elsie.
So, thank you everyone for all your inputs, for the sharing, and for even attending the session and staying through the session throughout. As I said before, I feel like I've collected so much information from this session. I know several people have raised concerns about the attendance link. What I will do is I will correct it and check if it is working well, and then just share it on the email when we end our meeting. I think my final and closing remark, apart from thanking all of you sincerely for showing up and for sharing, is just reminding all of us that the world is going through a lot. I think as people that are concerned, as people that have empathy, the world is going through a lot and it can get to us. I remember one time just not wanting to be on my Instagram because I am trying to share information about Congo. I'm trying to share about Sudan. I'm trying to share about the genocide in Gaza. Then Lebanon is happening. Then it seems like everything is happening at the same time. You also have issues you're dealing with. We have the economy, climate change. All of a sudden, Sahara is flooding. So it feels like overwhelming things are happening to you all the time. And it's okay to share with everyone. It does not make you weak. It does not make you less of a leader, less of a human if you accept and you call your mental health issues. I think part of the number one step to healing is just saying it loud. I think one of the things I've seen with people with sobriety is just accepting, saying, I'm a drunkard and I need help. So even with mental health, just saying, I have ADHD, I am depressed, I have bipolar, I am exhausted, I have suicide ideation. Just identifying and calling the demon by its name is one way of slaying it. And thank you, everyone. And I hope to see you on Tuesday. On Tuesday, we have another webinar. We are going to be talking about access to education for girls with disabilities. Some of the people that are on this session are going to be speakers. I'm going to be sending out invites, and I hope to see you. Asanteni sana. And you feel free to leave at your own pleasure. Thank you so much for showing up. Samuel says, good afternoon. Thank you for welcoming and sharing good ideas, information. Kwaheri, I see Madud says Kwaheri. I'm going to be here until all of you leave. Then I can leave as the last person. So